Hello, I'm Kelly Riedel, Senior Risk Management Consultant with ProAssurance. Today, I'd like to discuss patients who don't agree with the plan of care. Clinicians have a duty to provide patients with the information necessary to make a voluntary and informed decision about a proposed treatment, even if the patient's ultimate decision is not what the physician believes to be in the patient's best interest. Patients with decision-making capacity have the right to refuse medical treatment, and informed refusal supports one of the basic ethical principles of medicine, autonomy. Often, refusal of care comes at the end of the informed consent process, which lays the groundwork for informed refusal. In obtaining informed consent, clinicians should 1. Assess the patient's capacity to understand the treatment and make an informed decision. Remember that the 4 elements of capacity, understanding, appreciation, reasoning, and communication, are usually readily apparent through your clinical interaction. When it is not clear whether a patient's capacity is intact, a formal evaluation should be obtained. 2. Discuss the diagnosis and the risks, benefits, and alternatives of the proposed treatment. Remember to include the risks, benefits, and alternatives of refusing treatment too. 3. Confirm the patient's understanding and obtain informed consent or refusal. And finally, number 4, thoroughly document the informed consent conversation, including use of a signed consent or refusal form. Remember, having a signed form can strengthen documentation efforts and later serves as evidence that a comprehensive process occurred. If a patient declines or refuses the plan of care, objectively document your discussion with the patient in the medical record. The documentation should include the risks and benefits associated with the plan of care and the reason the patient isn't proceeding with the offered plan. Patient-centered care focuses on the needs and preferences of patients, involving them in all steps of the decision-making process. Ideally, care plans are developed together that meet both the needs of the patients and the goals of the desired outcome. When a patient refuses care in a patient-centered model with shared decision-making and a thorough informed refusal process, clinicians can simultaneously respect autonomy and lessen liability risks.